Hello and welcome to Health Matters. On today's programme we have urologist Dr. Wolfgang Kleimeier of the College Clinic. Dr. Kleimeier, thank you very much for joining us. The first topic I'd like to tackle is the prostate gland. I saw a programme recently on the UK. A reporter went out into the street, interviewed a lot of men, and actually very few knew where it was. Can you tell us exactly where is it located?
Yeah, if you have a look at the bladder, then just underneath your bladder, close to the penis, to the outlet, you would find the prostate. It's the size of a chestnut in a young man. And, well, just if you look at the urethra, if my finger's the urethra, the prostate is just around in the size of a chestnut, underneath your bladder neck.
Okay, and I made a mistake, didn't I? Because I called it prostrate.
Yes, you were quite well, because about 80% of my patients pronounce it the wrong way. It's prostate and not prostrate, like most people say.
Okay, so what is the function of this gland?
It's got two functions. The main function is that it has to produce the seminal fluid. 90% of the seminal fluid is being produced by the prostate, and only 10% is sperm and what else is needed for fertility reasons. And then it plays a role in the continence mechanism of the man.
What can go wrong with it? Because there are frequent problems that can arise.
The most frequent problem is the benign growth of the prostate. But I have patients, even after the age of 35, they might already notice some changes, like getting up at night time more frequently, not having the power once they pee, it's more dribbling, the urinary stream is not as strong as it was before. Or
is there any pain?
Well, usually if the prostate is just enlarged, there's no pain. But once the enlargement, and that's usually later on in life, once the enlargement leads to incomplete emptying of the bladder, then you might have urinary tract infections, we talk on later on as well, and then you might have the typical pain. But a pain as such is not related to the benign growth. But
somebody who is getting on in age and is starting to have a few little difficulties in that area, might they not assume that that's just the natural aging process? What would alert them to the fact that something might actually be wrong?
Well, the most common major problem is acute retention, because that is really extremely painful. I remember when I was still working in Germany, I had a Turkish patient being rushed in by the ambulance car, and he had acute urinary tract problems, acute retention. I got rid of the urine that he couldn't get rid of, and he wanted to kiss my feet, so it's really painful.
I can imagine it must have been very painful. So if you have a benign enlargement of the prostate gland, can that then progress into something more sinister if it's not treated?
Well, actually, it's usually a slow process over the years. We're not talking about acute changes that from one day to another you would have the benign growth. That's a slow process, starting already maybe at the age of 40, but then slowly progressing. Before we had the ultrasound to detect, for instance, some dilated renal system or incomplete emptying of the bladder, it was like grandpa was dying of, let's say, old age, but it was just non-functioning of the kidneys, but related to the prostate, which often is something they completely misunderstood.
Let's talk about something a little bit more problematic, perhaps, and that is prostate cancer. What are the symptoms for that?
Well, unfortunately, there's no symptoms at an early stage. That is why we actually promote, and in the UK there's a little bit more awareness lately, but in the United States, or as I know quite well from Germany, usually men are being advised to have a yearly checkup after the age of 45. As prostate cancer would not cause any problems at all, and that's a stage where we can heal the prostate cancer. And you know, this is a very common death for men, to die of prostate cancer, and it could be easily diagnosed by blood tests, the rectal exam plus an ultrasound. But once they come, and when I do the regular checkup, the yearly checkup, I tell my patients, go and have the cast checked once a year, but don't forget about your prostate.